First Responder Wellness is a specialized mental health and addiction treatment program that works only with first responders and their families. We created this program because we felt there was a real strong need for first responders to have a special place to work on the traumas that affect them in the jobs they do over the course of a career. One of the most unique things about our program is that it is treating first responders only. There are programs around who suggest that they treat first responders, but they're in a general population program and they have specialty groups for first responders. From the minute our first responders walk in the door, they see other men and women who are just like them, who've walked the walk, talked the talk, lived the life. And they feel comfortable and calm and like they're not the only ones. One of the biggest issues with seeking treatment for a first responder is that feeling of stigma and weakness. What they find in our program is strength. They realize that by talking about their problems, by getting to the bottom of it, it makes them stronger than ever before, and they can return to their jobs, their careers, and their families, knowing that they can cross the finish line, do their job better than ever before, and feel good as they go along.
I personally come from a first responder family, and I'm married to a fire captain. This is something that I'm absolutely passionate about. I'm passionate about seeing them get better. I'm passionate about seeing families grow and be healthy, and seeing that the job is not only something that they love, but it's a calling, and that it doesn't take away from their life, that their lives can be more fortuitous, and that we can actually be a part of teaching them core skills that maybe weren't learned about their mental wellness and family wellness, so that they can go out and be productive, awesome first responders helping others that still have a really healthy family and a lot to look forward to in retirement. We treat both substance use disorders and stress injuries, post-traumatic stress, and other mental health related conditions. We offer intensive psychotherapy. All of our therapists are trained in different trauma modalities. So we offer eye movement desensitization reprocessing. We also offer neurofeedback. We have an excellent team that works with psychiatry and takes care of their needs there when necessary, as well as we have therapists that are very much trained in directive approaches, which first responders tend to enjoy the most, is seeing what they learn in therapy they can apply in their real life, and it's not just sitting for a session, but things are getting done. The work is getting done.
So the patient experience for our clients is very smooth and easy. Normally the way it works is we'll get a call on the front end, and it's usually peer support or someone from the association, maybe a therapist, and they identify someone that may need to talk to us or need our help. From that point, we connect them to our admissions team. It's very seamless, it's very easy, and what admissions is really doing is gathering all the pertinent information in regards to substance abuse, if there is any, mental health, and then medical information as well as insurance information. And what the admissions process does is they gather all this information to make sure that the patients are right fit for our program.
Oftentimes that first phone call, I think, is the hardest phone call to make. I completely understand that. I am in active long-term recovery myself. I have been working with clients and families for nearly a decade with clinical work as well as intervention work. And myself, coming from a first responder background, I worked for juvenile justice in the late 1990s, and I absolutely understand the climate that our first responders face on a daily basis and the needs they serve in the outside community, being public servants. What I can tell you is, from that very first phone call, from the date that you enter treatment, whether it's the same day or we're setting it out a week or two, you will have compassionate, caring, and understanding help on the other end of the phone. We make sure that all of your needs are met, whether it's insurance, FMLA, time off from work, or maybe getting on the phone with your loved one to explain what the treatment process looks like. We're here to navigate all of that with you, and sometimes do it even for you.
Phase 1 of First Responder Wellness, which is also known as our residential care, is a stabilization period where if a client needs detoxification from chemicals, we bring them in and we start the detox process. We also use it as somewhat of a behavioral stabilization. So one of the first things that we do in stabilizing a client is really just get them into a 24-hour care where all eyes are on, all hands are on deck, and we're able to treat that client and really slow things down and begin to develop the treatment plan that will carry them through the rest of the treatment. Oftentimes chemical detox is done in a hospital setting. Here we're able to do it in a residential setting where it's overseen by a doctor and followed up with nurses. We have nursing staff that's available 24 hours a day. We do this in a safe and a manner where clients are able to be comfortable just as if they were at home and not in a hospital setting.
Paramount to treating our patients for the issues they come in with, whether that's alcohol, post-traumatic stress, anxiety, depression, or substance misuse, is also creating a community here of patients or people that are going through the same thing. And our alumni are really involved in creating that normalcy. So what we do with our alumni is they come in once a month and do an AA panel for our patients. They get to come back and they get to share their experience with our patients, and they get to tell what they did to be successful. They get to share all those things with our new patients on what they did when they went through. And really what we're trying to do is we're trying to normalize this experience. So many people prior to them getting here have been carrying around this secret deep inside that they don't want to share with anything. And what's really nice about our program is when they get here, they're surrounded by other people that are experiencing the exact same thing. And then what's great about our alumni being involved, our alumni get to share with them, hey, when I got here, I was just like you. And it's 6 months, it's 9 months, it's 2 years later, and this is what my life looks like today. And there's really hope.
I'm a police officer, approximately 20 years on the force. And I encountered just the stress of the job, which involved some PTSD, a lot of critical incidents, and then unfortunately the coping skills used to deal with all those things became alcohol. So alcohol and some trouble got me into the situation of coming here to the First Responder Wellness Program. And I'll be honest, it was life-saving as far as being able to change my perspective and how to deal with those things. You transition into a group of your peers, whether it be additional other law enforcement, EMS, whatever other agency they came from. You get here and you realize that it's okay not to be okay. I would definitely tell anyone that has any hint of PTSD or issues with any type of addiction, whether it be alcohol, drugs, or whatever your thing of choice may be, get some help.
Early in the developmental phases of first responder wellness, we realized the importance of helping the families to heal along with the clients. And what we had done is we developed a family program that would bridge the healing between the clients and the families. And we do it in providing an experience for the families, much like the experience that the clients have here at First Responder Wellness. And so the importance of having a family involved in a client's treatment is to help everybody realize exactly what's going on and exactly what's happened, all of the things that have led a client to treatment, as well as to help the families to heal, because they're a part of the journey as well, which means the whole family is affected. The unit itself is dysfunctional because of chemical dependency or untreated mental health. So it's imperative to the healing of the family and the client that both be involved in the treatment.
I came here after retiring with the LA County Sheriff's Department for 40 years. What brought me here is I care about the people in this profession. I understand what they go through, the trials and tribulations that they go through every day, and I feel like they need a place to be taken care of where we can wrap our arms around them. Tragically, I lost 2 nephews to opioid overdose, so I became very educated about addiction and all that it is and all that it isn't. And what I learned through that is it affects everybody, and the brothers and sisters I have in this profession are not immune from that. And so I wanted to do everything I could to help those people that I love and care about.
During my time as a police officer, I encountered many different things, as all police officers do. And one of the things is high intensity stress that I dealt with alcohol. It turned into addiction with pain medication after an injury. My name is Mike Cook, and I work as a case manager at First Responder Wellness. I was a police officer for 19 years, and the last 10 years of my work, I was an undercover narcotics detective. The culture of being a first responder, being a police officer, or being a firefighter, it's where you are able to handle extreme situations, that's why you're hired, and maintain composure based on your training and experience and get through anything safe and your partner's safe. However, afterwards, if you don't process that, talk about it, you think that showing your feelings is a weakness, then the possibility of resorting to other means of coping with that stress and anxiety can lead down a really dark path. And that's the path that I took because I felt that it was a weakness for asking for help, and didn't know that there was actually confidential help out there available for me. Definitely there wasn't a place like a First Responder Wellness to have a safe harbor and a confidentiality with other first responders together as peers suffering from very similar circumstances and situations. And this is what First Responder Wellness is all about.
The beautiful thing is we work as a team, because that's what I'm looking for, and that's what a lot of us clinicians that work with this population understand, the need for a team to wrap around these first responders. I can know wholeheartedly when I send my first responders to First Responder Wellness is that I'm gonna get weekly check-ins, I'm gonna get callbacks, we're gonna be all on the same page as far as the treatment plan. They get handed off, and patients will call and check in with me on a daily basis if there's any questions. It's really nice because they know there's all of us on board trying to navigate through this.
My passion for working with first responders is that there's an earnestness and a desire to help others that I really resonate with. My entire career has been about helping other people find their way and find their path. And whether it's in the middle of a really bad call or in the aftermath, I think one of the things that resonates with me more than anything is being someone who can help the helpers.